and welcome to Trust TV. I'm Ruth from your communications team, and as you can see from the screens behind all of us, this week we are celebrating the World Health Organization's global annual campaign, Save Lives, Clean Your Hands. So in this episode, we're going to explore why hand hygiene is possibly the most effective measure that we can all take to prevent the spread of infection. So to discuss this, I'm joined by three of the leaders from within our junior doctor cadre, Doctors Mark McKeever, Martin King, and Danielle Thornton. You're all very welcome. So Mark, if I can put the first question to you, please. We know that hand hygiene plays a vital role in reducing the spread of infections like COVID-19. Can you explain the science behind this?
Yeah, of course. Thank you, Ruth. So essentially, it's quite simple science, really, and it's been about for many years. So actually, we're 170 years, to be fully honest. Essentially, we carry pathogens on our hands, and when we wash our hands, we wash those pathogens off. We reduce the load of bacteria and viruses, and we prevent the spread to our patients, to our friends, to ourselves on eating. And really, as I alluded, for 170 years, this has been about, since 1847, when the father of hand hygiene, Ignaz Semmelweis, who's a Hungarian doctor who worked in a general hospital in Vienna, he established that actually washing your hands in between cadaveric dissection and delivering babies reduced mortality. Then moving on to Florence Nightingale, she then showed that working with the military wounded, if you simply washed your hands and washed the bed linen and used some simple infection control measures, again, saved countless lives. Then obviously moved through Louis Pasteur, Robert Koch, all the big names in microbiology right up until the 1900s, when surgeons started to pay attention and they started sort of the antiseptic surgery using chlorine-based washes to clean their tools and wash their hands. And actually then a big movement with the anti-TB movement really pushed the hygiene movement forward around the 1900s. Sort of fell in and around World War II. The baby boomers actually started to fall with the hand hygiene, and then it took a big re-emergence from the 1980s, and that sort of stuck around right up until pre-pandemic. However, hand hygiene's always been low before the pandemic. Back in 2009, the American Journal of Infection Control showed that only 10% of men and 7% of women would have washed their hands before eating. And this was at university level. This was university students they were talking to. So it's simple science. It's there. It's been proven to work to save people. And it's been an ongoing battle. That's why things like this, big movements like this, are so important for hand hygiene.
Thank you. So those seconds really do save lives then, as the slogan says, and it's embedded in our history. Danielle, can I come to you? You work within a GP practice. Is hand hygiene a priority for you and your colleagues in primary care?
Well, I think the COVID pandemic has undoubtedly highlighted the benefits and importance of hand hygiene in GP practices and beyond. So within most of the GP practices, there have been a number of changes made to surgeries to encourage hand hygiene. So every person entering the GP surgery, both staff and patients alike, are asked to sanitize their hands on arrival and exit from the building. And that has become so common now that it is just a natural reaction for everybody coming into the building. They immediately go for the alcohol, foam or gel, including small children. 3-year-olds are going automatically. So I think that the COVID pandemic has really naturally just increased everybody's awareness of the importance of hand hygiene. Within the practices, even, you would have seen over the last year, increased alcohol and hand sanitizing gel dispensers throughout the surgeries on the walls, so that everybody's really encouraged to have those hand hygiene opportunities. Even you're walking up the corridor, people just go for it now naturally. I think the very visible infection prevention protocol of wearing PPE and donning and doffing between patients has also increase people's hand hygiene moments. So you're washing before you don, you're obviously washing your hands afterwards, which I think probably wasn't in a busy general practice day before we were wearing the PPE, etc., perhaps people didn't take advantage of all those hand hygiene opportunities that they definitely are now. And I think as well, there's been increased awareness of the sanitizing of our commonly used instruments and equipments, you know, your stethoscopes, etc. And people are definitely sanitizing those in between patients very pedantically now, whereas beforehand, maybe the awareness wasn't there to do that as often as we're doing now. So I think in conclusion, the COVID pandemic has brought a lot of positive changes to general practice and probably all areas of medicine with regards to hand hygiene.
Isn't that brilliant? Actually, the impact of this has been that in your practice anyway, we've seen hand hygiene actually become a habit, which maybe wasn't there before. Martin, if I come finally to you, we know that hand hygiene prevents up to 50% of avoidable infections acquired during healthcare delivery. And yet, despite this, compliance is still unacceptably low amongst healthcare workers, not just locally, but you know that's globally. Why do you think that is? And what would you say to your colleagues to encourage them to make hand hygiene the cornerstone of safe patient care?
Thank you, Ruth. A bit like Danielle and Mark, I think what has happened in the past year has been a demonstration across populations as to the simple measure of hand hygiene and how it can really affect patients from a positive outcome and actually reducing the risk of transmission and infection. With regards to the healthcare environment and the clinical environment, we are very au fait with our donning and doffing procedures, and really I think we've demonstrated a commitment to obviously respecting those procedures. I think the wider healthcare environment beyond COVID red and COVID green areas is that we really should use the 5th of May as a reflection point as to the wider risks involved in the healthcare setting, and notably for a moment to challenge behaviour, albeit in a constructive way. And we can begin to actually foster a culture where it's a good thing to be seen to be washing your hands and to be a more frequent and regular thing. And I think our behaviour has improved from COVID. But I do would echo kind of the sentiments of the campaign on the 5th of May, that we can begin to bring that into the wider hospital environment as opposed to our more high risk infection environments. Some examples are that is just to take time out and pause and reflect as to when was the last time that you did wash your hands. Think of those touch points in between your last interaction between a colleague or an actual piece of equipment. That doesn't necessarily have to be a clinical piece of equipment like Danielle has alluded to, our stethoscope. Everything we touch in that clinical environment, we have trust that we've relied on upon our colleagues and peers to actually have appropriately sanitized that. So I'm proud to support the World Hand Hygiene Day on the 5th of May. I think it's a great initiative for us as an organisation to foster that culture and build upon the tremendous work that we've shown over the past year and continually improve.
Well, thank you very much. I think you've all reminded us why hand hygiene must be the basis of safe care. And as the campaign slogan this year says, those very valuable seconds really do save lives. So we're going to leave you now with a video reminder of the exact steps involved in effective hand hygiene, so you can be absolutely confident that your patients are in safe hands. Thank you.